Hello and welcome back to our Paediatric First Aid course.
In this episode, we will be looking at prioritising treatment and performing a head-to-toe check.
So let's look at prioritising treatment, or
DRABC.
That's danger, response, airway, breathing, circulation.
D, danger. First of all, check for any danger. Is it safe to help? Don't put any more lives at risk.
Second, response. Check for consciousness by gently tapping the child's shoulders. Ask the child if they are alright in a loud and clear voice. Ring 999. You believe this is an emergency.
If child is on their back, the airway can be at risk. This brings us onto A.
Airway. Identify and treat any airway problems. If the child is unconscious, tilt the head back to open the airway. When the airway is clear or open, move on to B.
Breathing. Identify the problem if there is one. If the child is unconscious and not breathing properly, we would normally perform CPR. We will cover this in the next film. If the child is breathing normally, place on their side in the recovery position as seen, then move on to C.
Circulation. Identify the problem. For example, your child might be blue and cold. These are signs of circulatory shock. This is very severe and may require CPR. Your 999 call handler will also be able to give you some advice around this. Start with the most severe problem and then move on to more minor injuries like cuts and bruises.
And this is how we prioritize our treatment.
What we also need to look at in this episode is performing a head-to-toe examination.
This is pretty much how it sounds, but let's run through this in more detail.
This check allows us to get a great understanding of what might be wrong with our casualty.
It will also allow us to tell the emergency services what they might need to do on arrival before they get to the scene, or if we can handle the problem ourselves.
You'll want to start with the head and neck. Think about if they might have injured their spine and be careful with any movement. If you don't think it's safe, don't move the child.
If you can, check the pupils. Ask yourself if they are big, small, rolled back into the head, or even unequal. This will let you know if there is something more serious going on. You can let the emergency services know right away.
Look around the head and face for any bruising or swelling, bleeding or discharge from the nose or ears.
Move your checks down to the shoulders and chest. Compare shoulders and collarbones. Are there signs of fractures?
Ask the child to take a deep breath. Can you see the chest move easily and equally on both sides? Does this cause pain? Is their breathing shallow, laboured or heavy?
Then look for additional injuries and cuts.
We now move on to the abdomen. This is the area between the chest and pelvis, commonly known as the belly.
Check the abdomen. You want it to be nice and soft. Don't press down too hard or do anything that can aggravate an injury.
Look for incontinence. If the casualty has pooed or weed themselves and can't control it, or if they are bleeding.
Do not squeeze or rock the pelvis around the hips.
After this, you can check the casualty's limbs. This is the last part of the body you'll be checking.
Ask yourself if they can move the limbs without causing pain, and then check for signs of fracture, deformity or bleeding.
The final thing to do is check for any additional medical information you might be able to find. Think back to the previous video and where and what these might look like.
Remember, if you have ended the 999 call, you can call back to update with new or additional information.
Prioritising treatment and doing a correct head-to-toe check will allow you to identify what you might need to do in order to help your child.
It can also help to give vital information to others so they can come prepared and ready for the situation ahead, or will help you to assess the problem and help the child on your own.
You can practice these techniques without your child being ill or injured.
Practice makes perfect.
See you next time!
Nosebleeds.
Yeah, but it's worth it when they taste.
That's confusing. That's confusing. That's like lead to nose.